Okay, I am observing the patient, checking from the thorax down. The patient is posterior relaxed and upright. Her facial expression is relaxed. Her face, lips, and chest are even, and there is no discoloration noted. Checking her hands and her nails. They are pink, and there is no clubbing noted to the nails. No nasal flaring, no lip pursing when breathing. Not that if she were bare or he were bare, we would be looking for accessory muscles while breathing or chest expansion to make sure that it is symmetric. Going to go ahead and count respirations as she is breathing. Just breathe in normally. Respirations appear unimpaired at 16 breaths per minute. I'm going to put on a pair of gloves, and I would palpate to check for tenderness or pain. Let me know if anything hurts. Okay. Okay. Every time I go down, you're going to say 99. Okay.
99, 99, 99, 99.
Good. Now I'm going to do the same thing to the back side. And again, anytime I strike the back or put my hands down on your back, say 99.
99.
Let me scoot you up a little bit. Thank you.
99, 99, 99.
Good. I will now be percussing. You should be able to hear, which of course would be easier if we were able to lay her down. Any pain or tenderness?
No.
No? Okay, I'm going to grab my stethoscope and we're going to listen to some lung sounds. Lifting off my gel. And then warm it up a little bit. Usually there are no clothing involved when listening to lung sounds. No gown or drape would be on her, but for the sake of privacy right now, we're going to go ahead and leave everything on. Take a deep breath. Good. Every time I lay the bell down, just take a good breath. There's 10 sides in the front that you want to assess, and then there were 20 sides on the back that you would want to assess. Every time I lay this down, take a deep breath. For the sake of not having her pass out, this is the area that we go through. So I'm going to go ahead and skip down to the bottom base. Good. Now I'm going to look at her neck, and I would be assessing her jugular vein. We're able to do this at a 30 60 and 90-degree angle. We're checking for neck distension. There's no jugular distension noted at this time. I'm going to go ahead and listen to the carotid artery. Turn your head, please. Turn your head the other way. Good. And there are no were checked. Pulses are 2+ with no variation. Arteries were elastic, no thrills or no murmurs were noted. I'm going to go ahead and palpate the carotid artery on each side. I'm going to, let's see. I don't mean to cause any pain or discomfort. And then I would do it on the other side as well. We'll start here. No palpitations or no variations were noted. I'm going to listen to your heart. And there's 5 different places where you place the stethoscope. You are to listen to the heart for a complete minute. For the sake of video, I'm going to do it at half. Heart rate is 76, regular. Now I'm going to do an assessment of the arms and the legs. First, by just looking them over. We have no edema noted. Bilaterally, skin is warm, dry. Cap refill is less than 3 seconds on the fingernails. Toenails, I would do the same. She has polish on her nails, so I wouldn't be able to assess that. The feet, the legs, temperature would be all the way down from the groin to the toes and would be warm to the touch. She has not recently shaved, so there's no nicked areas. We would check for pulses, including popliteal. And then check for edema. And there is trace edema noted, usually probably due to dependent edema. And that concludes.